everybody today. We did have a veteran lined up. I think he's still out of town. So let's rise and do the pledge, please. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have the roll call, please.
Mr. Henry.
Here.
Mr. King.
Here.
Ms. Reagan.
Here.
Mr. Murphy.
Here.
Okay, thank you very much. And then we do have some appointments to the Civic Center Authority Board. And I don't believe we have our director here. What's your pleasure on this? I don't believe either one of the appointments. Would you like to postpone it?
One reason she sent the letter. She had to be.
That's fine.
I'll make a motion to appoint Billy Shepard and Sarah Beach to the Civic Center Authority Board.
I'll second
Roll call.
Mr. King.
it. Yes.
Mr. Henry.
Yes.
Ms. Reagan.
Yes. And then we do have a correction. In my 2.5 years, I believe this is our first correction, so I would like to acknowledge that our secretary does not make any mistakes, but we did have a change. The corrections should be, the ordinance for the Board of Health should be 2015-015. So if you would like to entertain a motion to accept them as changed.
Motion to approve.
Second.
Roll call.
Mr. Henry.
Yes.
Mr. King.
Yes.
Ms. Reagan.
Yes. Thank you, Denise.
Thanks, Jerry.
Okay, now we have a presentation. Mr. Brookhouse here today.
Good morning, Commissioners. Brad Bookout, the Delaware County Economic Development. I'm pleased this morning to introduce to you Peggy Sinova with the Indiana Small Business Development Center. As you're aware, startup businesses and entrepreneurs are an intricate part of economic development or any economic development organization. However, when we're working with county money and taxpayer dollars, rather than just incentivizing companies, we believe that they should be fostered and worked with by business professionals to make sure that the companies are worthy of investment. It's important to know that startup businesses or entrepreneurs,
Talk louder.
I'm sorry, it's important to know that businesses have a business plan, have a financial plan, and that they are revenue positive for a certain period of time before financial incentives are offered to those companies. So we believe, and we have started a new working relationship with the Indiana Small Business Development Center to have those companies, those startups, and those entrepreneurs to go before the Small Business Development Center and have them work with them to foster business plans and financial plans for their future. After they show revenue positive for a while, we would then entertain working with those companies on future projects. So anyways, I'll introduce Peggy to you today. Peggy's going to give you an overview of what she does, how she works her operation, and how we'll be working with startup companies going forward.
Thank you, Brad.
Hi, I'm Peggy Sinova, Regional Director for the East Central ISBDC. And Brad's given me the opportunity here and invited me to talk with you all about what we do. We have what I think is our most important issue is that we do one-on-one business counseling with startups and businesses already in business for helping them at no cost to them. We are funded through federal, state, and local funds. We have lots of software available to research demographics on what their businesses might be able to do, to look at how other businesses are doing in the area they want to start out at. We have industry reports that show whether their industry is increasing or decreasing and what the latest things are on what they're wanting to do. We very importantly help them understand their financials. And I think that those who we work with that are coming to us and ready to invest their 401k, it's just important to those who are doing all of their own money that we let them know this might not work and through financial pro formas, sometimes they figure out it's not a good investment themselves. We help build loan packages, we work with local bankers and with revolving loan funds, and with even Kiva and BEAD funds to help them with hands-on assistance in their loan packages and in getting their financial life together. In the past 24 months, we've helped 13 businesses start. We've helped them raise or invest capital of $7.8 million. We've created 68 jobs. We've helped retain 127. And that is through helping 128 clients with 828 hours of counseling. We've done 48 training sessions, which had 905 attendees. Many economic development people tell you what they're doing and say that they've helped this, but this is what I really like about Indiana Small Business Development Center. Each one of these numbers has to be verified in writing from the person we helped, that yes, we did help them in some way with this. So our numbers are validated. That's been taking place for about 4 years, and I'm really proud of it. I'm open to any questions you might have.
Well, Peggy, you might give us the address to the TV folks at home
We're
that
the
are
Innovation
watching this.
Connector, 12008 West White River Boulevard. We also have hours at the Downtown Business Connector by appointment.
And you're serving 11 counties, so you're a busy staff, I'm sure.
We are a busy staff. It consists of me and 2 other business advisors and an administrative assistant. So
And
we're
no-
on the road.
No business is too small to come and see you, correct?
No business is too small,
And
and up to 500.
Up to- And we know that this is where the growth of Indiana is coming from,
Yes, we do.
because, and we want to retain them here, so.
We want to retain them here, and I always say, you know, a big get is to get a new factory, or someone's going to have 100, 200 employees. But if we added 2 employees to each small business in Delaware County, that'd be a big get.
That is wonderful. Well, thank you. And how long you been with the agency?
I started as a business advisor in 2009 and became the regional director in 2011.
Well, thank you so much, and thanks for being here. Guys, any questions?
Thank you.
Thank you.
Thank Brad for bringing Peggy to us today. Okay, we have some contracts for the mental health service. I believe this lives here today. Morning.
Morning.
You're on.
I'm on? Okay. We just got agreement for our inmate mental health services. The doctor that we're using up there is Dr. Bob Hatfield. James is familiar with him. We both went to high school with him. He's a lifelong resident in Delaware County. Dr. Hatfield has really taken this program to new leaps and bounds with the he has an ownership policy. He owns, takes ownership in Delaware County and our residents. One of the things that, Sherry, you know as well as I do, that we've geared stuff towards CIT now. Excuse me. And we've realized that a lot of subjects that are coming through the Delaware County Jail have some mental and physical handicaps that's causing them to reoccur visits up at the jail. Dr. Hatfield also realizes this. He's developed several new programs where we're trying to detour their visits to the jail and get them the help that they need, based on his sessions with them and groups that he started. As well with this, Dr. Hatfield helps educate not only the merit deputies, but all the correctional staff to recognize some of these things as they come into the jail, so that if the inmate themselves doesn't get a hold of the doctor, then it may be that one of the correctional officers will tell the doctor about that inmate, that particular inmate. So
Yeah.
he's really doing a lot of good things with the with our inmate population, as well as educating the correctional staff on.
I'm glad you mentioned that he's got some new things going. When I became a county commissioner, I was so impressed with what mental health and what the inmates are able to do during the day to better themselves.
Yes.
The different programs, and I'm sure you'll continue and keep adding.
Yeah, matter of fact, he's got a couple new things working right now. He's going to bring the guidelines of them when he gets them. I'll pass them on to all 3 of you.
I don't know the doctor. I'd like to meet him sometimes, but thanks for bringing us this update today.
He also does counseling for students at Muncie Central High School as well.
Okay.
So, and if you go to any of the games this year, the fine young quarterback that's playing over there is his son, so.
Okay. Okay, well, thanks, Sheriff, for bringing this to our attention.
You're welcome.
Legislature.
Make a motion to accept the agreement for the inmate mental health service.
I'll second.
Roll call.
Mr. King,
Yes.
Mr. Henry,
Yes.
Ms. Reagan,
Yes, thank you. Okay, then we have an ordinance for second reading, ordinance 2015-015. That's the Board of Health.
Make a motion to accept ordinance number 2015-013.
Second.
Well, no, it's 15.
15.
Roll call.
Mr. Henry,
Yes.
Mr. King,
Yes.
Ms. Reagan,
Yes, thank you. Okay, then we have an ordinance for first reading, ordinance 2015, and is that 016?
Yes.
Thank you. Comprehensive zoning ordinances. Oh, Marta's not here today.
She is not. She had another meeting, so I'm here
So
to,
introduce yourself.
I'm Lori Stinton with the Plan Commission, and the ordinance before you is to amend a 12-acre parcel from a residence zone to the F farming zone. If you have any questions about the case itself, Mr. Brown is here, or I could try to answer.
Well, I did see where it got a favorable recommendation, 6-0, so that's very encouraging. And,
I make a motion to introduce ordinance number 2015-016.
I'll second it.
okay, thank you, Laura. Roll call, please.
Mr. King,
Yes.
Mr. Henry,
Yes.
Ms. Reagan,
Yes,
Okay, since this has already been approved by their board,
I don't believe we have to.
no, we can just approve
Just go ahead
the
and
second.
approve
today,
Yes.
okay. Thank you for catching that.
Do we need to suspend the rules then?
it. No.
You just,
I'll just make a motion to accept ordinance number 2015-16.
I'll second it.
Roll call.
Mr. Henry,
Yes.
Mr. King,
Yes.
Ms. Reagan,
Yes. Okay, thank you, please. Okay, now we have department heads, elected officials. And we have the, oh, Jason's up here. Okay, yes, Jason.
Good morning, Jason Rogers, Director of Emergency Management. I've got a couple of things to review with you this morning. First of all, I've got the write-offs for Delaware County EMS that I'd like to cover for July. Our write-offs totaling $360,868.34. Denise, I've got these printed for you. So I need a motion for that, and then I was not able to attend the Commissioners' meeting in May, and I have those numbers as well that I'll present to you as staff to do those July ones.
Motion to approve the write-off.
Second.
Roll call.
Mr. Henry,
Yes.
Mr. King,
Yes.
Ms. Reagan,
Yes.
And then for May of 15, the total write-offs were $428,291.23.
Motion to approve write-off.
Second.
Roll call.
Mr. King,
Yes.
Mr. Henry,
Yes.
Ms. Reagan,
Yes.
At the end of August, we will have been with our new billing company for 1 year, and we'll be able to give you a solid figure on how much more money that we're actually bringing in, because we're saving over 2% for our billing services, as well adjusting our fees. I'm pleased at the numbers so far. We're averaging between $25,000 and $50,000 a month more money. It does seem like we're writing off an awful lot. However, some of the contracts that we've gone into and some of the Medicaid and Medicare acceptance for us to be in those programs, we have to write those monies off. So it may seem like we're writing an awful lot of money off, but we're actually bringing a lot more money in because of the programs that we've initiated. So I'm very pleased at the numbers, and I think we will be ahead of the ballgame from years past as far as the end of the year. I am pleased also to announce to you that the Blue & Company contract should produce a substantial amount of money that will go into the county general fund, which I'm very excited about, for 2 years. So the first 2 years, which I believe are 11 and 12, we should see that money hopefully by the end of the month. So about this time next month, I should have a number on that as well. And this is the meeting that Commissioner Henry's been to several times, and a couple of the council members have been to it, and we're looking to recap somewhere around $300,000.
Could you refresh our memory what the Blue contract is?
Blue and Company is essentially a Medicare, Medicaid recap. There were some errors in Medicaid and Medicare that were not allowing us to get the money, the full amounts of money that we were actually allotted, and that was caught by Medicaid and Medicare. We were given notice of that. It required us to go back and essentially appraise all of our value. So everything from buildings to ambulances to personnel to what percentage that we were then able to recap from those monies. Blue and Company is actually a subsidiary that is an actuary that is doing those figures for us, and then we're submitting to Medicare. We paid a flat fee for them, and I want to say it was somewhere around $10,000, I think. And in that, for that return, we're going to get somewhere around 300. So very, very pleased with the numbers so far, and I'll have some of those, I'm hoping, at least for the first 2 years, in about a month. And then we can expect the correction of, let's see, 12, 13, and 14 next year sometime. So then we should be able to catch up there. So that is certainly some good news as far as those funds are concerned, and bringing some more money into Delaware County. Recently, the Emergency Management Advisory Council met and appointed or approved the appointment of John Catino as the new Deputy Director. John comes to us the Emergency Management Office as a volunteer. John's been with us for over 5 years, and he is a hazardous materials technician qualified. He has his FEMA core curriculum education complete, and his professional development series complete. So he has actually been working for us for free for about the last month to fill in while Steve Savage moved on to Florida to get married. So wish him the best of luck. But John has been filling Steve's shoes for us and been doing a great job so far. And he will start with us, I believe, on the 28th, actually full time. But he's been the interim director for a couple of weeks now, and been doing a great job. So.
Let's embarrass him having
Sure.
come up and just
John, you
tell him
want to
about
stand
himself.
up and make sure we get
John, you're going to have to be in front of the public sometime.
It doesn't bother me at all.
Yeah, just step to the microphone and tell us a little bit about yourself.
My name is John Catino. Previously, I've worked for Albany Police Department for about 15 years.
So you know this guy.
I do. I worked at the hospital also for 11 years this year. 10 of those years were on midnight shift. Just recently went to day shift. I've been with emergency management for 5 years now. Served on Albany EMS for 15 years. I've since left there, but joined when I was 15. Quit when I was 30, and also a member of the Albany Volunteer Fire Department for probably 14 or 15 years as well.
Now, you tell me you are a graduate of Monroe Central,
Right.
but you've spent a lot of time over here in Delaware County, I can say
Correct.
then. So,
Correct.
well, welcome to the county, and we're glad that you're now have a title and getting paid for it.
Thank you.
Thank you very much for coming.
And one last thing I have for you. My apologies for not getting this to you sooner. I got it last week, and I was actually off work. I had some kidney stones that I needed to deal with, and spent some time in the hospital, so was not available, and John was taking the calls for me. So the Indiana Department of Homeland Security did send out last week a new ordinance. They have been approved for review for all 92 counties. And essentially, I sent it to you, I think, Friday, Mr. Murphy. I don't know if you've had a chance to look at it.
I have, and it'll be on the agenda for next week.
Okay, and what I'm going to do is invite Rob Puckett to come give a little more explanation, kind of what the thinking is for this new ordinance. But essentially, it's going to change the signatory places for receiving these grants, and hopefully speed that up just a little bit. And then the last thing I have for you is tomorrow, the Federal Emergency Management Agency Joint Preliminary Damage Assessment Team will be here in Muncie. We have reached, with cooperation between the county and the city of Muncie, we have reached our threshold for the floods that we have had here recently as far as our primary damage assessments, and that includes all of our critical infrastructure and public infrastructure, roads, bridges, ditches, so tomorrow the JPDA staff will be in town. I believe Commissioner Henry is going to attend, and the mayor is going to be there. And just like to thank you up front for your assistance with getting all that stuff started and going. It's been a mountainous amount of paperwork to even get them to look at us, but we've got it done, so the first door is open to getting some money brought back into the community. So with lots of luck and all of our documentation, tomorrow will be successful, and we'll be moving on to the reimbursements from the Federal Emergency Management Agency. So that's kind of it in a nutshell, where we've been for about the last month and a half. And
You've been very busy.
we have been very busy, so appreciate your time, and thank you very much.
Would you like to brag about your daughter while you're there on
Um,
4-H? It's so important that we lift these
Well,
4-H students.
Yes, I'm about as far away from a farmer as there is, but my daughter a couple of years ago has been begging to raise a steer in 4-H, and I finally broke down. My father-in-law owns a farm here in Delaware County, and we decided that if she'd get up every morning at 5:30 and I'd take her over there to feed and water her through the winter and all that, we would do that. And so we got her a steer, and she was, the steer was born and raised here in Delaware County, and last year she put 600 pounds on him, and she won the grade of game, and in her junior 4-H competition, she finished second. So very, very pleased and proud of her. And as a matter of fact, yesterday I got text messages from her saying that she wanted to look at some more steers for next year. So looks like I'm in the farming business.
Well, thank you. And 4-H is so important.
It is, and I gotta say, much respect to all the farmers in Delaware County, because let me tell you, it's a lot of work.
There's a lot of work. Thanks, Jason. Okay, we have a edit capital improvement plan with Mr. Murphy. Like to fill us in on this?
We talked at some length last year about adding some funds from the edit plan to help with the cost of county health insurance, and that issue came up again last week. So we have before you a proposed amended edit plan which puts us a substantial amount of money toward health insurance. We may need to tweak this down the road, but we just took some money out of other projects.
So you just kind of found some money
That hadn't been used yet, correct, and might not need to be used during this plan runs until June 30th of 2016. We'll need to do another plan at that point, but this will at least solve the problem with the cost of health insurance for now. We may need to deal with it again.
And this is project 54 for county employees' health insurance, $500,000 that will go into our, and Mr. Rick's out there. Would you like to talk to this, Rick, about how we are in such dire need?
Rich Spangler, Human Resources Director. Last year, as many of us know, the council took some extra money out of your health insurance funding. And so to supplement the shortage, I'm not coming out, so to supplement the shortage, you guys needed to come up with the money through edit to pay that out. Hopefully this $500,000 will get us through the end of the year, to pay for our current health insurance needs.
Okay, thank you very much, Rick.
Can I just-
Sure, James.
And for the employees, when the money was reduced from your insurance, if we wouldn't have done this out of edit, just so you guys know, your insurance probably would have went up about 50 to 60% of what you're paying now. So, I mean, the commissioners did step up to the plate to make sure you guys still had your insurance. We don't know what the insurance is gonna look like this year, if we're going to get cut again, but I can tell you, next year we won't be able to take any money out of edit.
No.
So if it was me, I would be contacting my council members. Please don't cut the insurance, because it could be the 50 to 60% next year if we get cut. So I just want you guys to understand that with the edit plan, we did it for you guys, okay?
Thank you. So, entertain a motion to,
I make a motion to accept the third amended economic development income tax capital improvement plan.
I'll second.
roll call.
Mr. Henry.
Yes.
Mr. King.
Yes.
Ms. Reagan.
Yes. Okay, thanks to Patty for working on that also. Okay, now we, have anybody else back there? Chris, you wanna step over to the mic? We're getting caught up finally on potholes, right?
I think we've got our arms around it. I feel better today what I felt last month about it. At any given time, last couple of months, we've had 150 complaints every day. And we get some of them taken care of, the next day you get more. And it's getting,
Yeah.
we only have maybe 50 or 75 on file right now.
Okay. And I would like to say that you can kind of say that we've probably been down every county road at least once, right?
Now what?
You've been down every county road at least once.
Not every county road, but the roads that we've had problems with.
Okay.
We sometimes have to go back because in the spring.
Well, sure, and that's what I want
We
to,
did the worst, and now we even have to go back over some of them.
right, that's what I want to say, because we can't be everywhere, so if people are still having trouble, please call 747-7818.
Yes.
Leave it on the
Yes.
machine if no one's there.
Oh, we got 2 girls up there taking complaints.
But, because some of them have been washed out.
Yeah, they come back.
Yeah.
It's been a terrible winter, and we've all talked about it.
Right.
I don't know what'll happen next year if we have a winter like we had in the last 2 years. I don't know.
Are we going to do any chip and seal? People have been asking me.
Yeah, I identified some roads up north that we talked about, and actually we're gonna contract a contractor do some milling up there, and we're gonna try to turn them roads into chip and seal.
Okay.
See that works out, because we have old equipment, and we're not really sure about how our equipment's gonna hold up, but we do have some plans to do that with this.
I forget how many miles it was, but those are mostly the roads that are west of 69.
Yes, yes.
That have not had any attention for some time.
That's right.
So I like that idea because, you'll just
Right.
put it right back down and
And,
they'll roll it.
They'll
I think
fall,
they'll be-
they'll grade it, roll it, and all we'll do is come through and chip and seal. They'll fog it and get it ready.
Yeah, do you have any idea how soon the company
No,
said
we're
they could
still in
be there?
negotiations with them, Sherry. I mean,
Okay.
they started out a little bit high, and they came back today with a different offer, so we're getting there.
Okay, thank you very much for the update. Okay, anybody else? Okay, then we have some payments of claims of $1,046,962.21.
Make a motion for the payment of claims.
I'll second.
Roll call.
Mr. King.
Yes.
Mr. Henry.
Yes.
Ms. Reagan.
Yes. Thank you. Any questions, comments from the public?
I have a comment.
You have a comment? Okay.
Do you want me to stand over there?
Well, you can talk.
Okay.
You have a mic.
I'm Denise Smith, and I'm a taxpayer of Delaware County. My family have lived here all of our life, and I just wanted to commend the city, Steve Stewart and his staff, Ray Dudley, the county and his staff, the state police, the prosecutor's office, for the plan of action that they've taken in Muncie and Delaware County for the meth labs. And as a taxpayer and as a citizen of Delaware County, we have to take back our county. We cannot let this ruin Delaware County. And so I say, we all need to support our enforcements. And Steve Stewart made a comment in the paper that we will find you. We cannot leave the county building at night and walk by the bus station on the way to our parking spaces or places and be afraid to walk to our cars. And I'm stepping up and I'm asking everyone else in Delaware County, we have to protect our children, the elderly, and animals. The chemicals that are in these labs, you know, they affect a lot of people. I know there was a drug bust out on Hoyt, and it was the grandmother of the young kid. Her house is ruined. I mean, you can't just go back and live in a house like that. So I say, you know, I know my family is taking, you know, knowledge of the hard work that they're doing. I've talked to Shannon. He's educated me. So has James on things that take place on these drug busts. I mean, it costs a lot of money. So I just wanted to thank everyone for helping our community get a better, you know, hopefully handle on this. And that's all I wanted to say.
Well, you're very welcome. And Dudley, would you like to step up? Because I know you said we had a nice little conversation Saturday about this.
Sure, Sheriff Ray Dudley. So everybody is aware we do have a meth problem and a heroin problem in Delaware County. You know, a lot of people talk about Muncie and Delaware County being #1 in the state on meth labs. Well, this is only because of the dedicated law enforcement that we do have in our county.
Right.
That's just not the city police or the county. It's Albany and Delville and Yorktown and Selma and all the rest of the departments that we have, as well as with the support that we have from our prosecutor, Jeff Arnold, and his staff. We do a pretty good job, and the only way for the state to get their estimates or their totals is by bus or by recovered labs that they do have. So that's why we're leading the state. It also helps that we have our own lab team that is dedicated for Delaware County. So that doesn't necessarily mean that Marion County has less than us. They probably have more than us. They have a lot more people. They just don't have the figures added like we do. It all goes back to just neighbors being neighbors. You know, if you think about each of us when we was young, you know, you knew everybody from blocks around your house. It's not that way anymore. People's gotten too fast and too busy, and all they care about is within the walls of their house. People need to open their blinds, open their windows back up, and start caring about their neighbors, keeping an eye. Because if you don't think it's going to come to you, it is. If you're not looking out for the people next to you, they're not looking out for you. And that's what you count on around your neighbors, is your neighbors. Whether you live in the county or the city or in a small town, it's all about neighbors. If the neighbors and the citizens don't report this, we don't know. So we need to get more educated. Contact any of your local police departments. They'll send an officer out. They'll show you and tell you. Get on the internet. Hit meth labs on the internet. It'll show you everything.
Thank you, Ray. And you know, Ray, while you're there, I'd like to say that it reaches all families, rich, poor, black, white, whatever. And we do have a problem with some of these younger people and older people that have addictions that are not getting treatment and cannot pass the drug test. And I tell you, it's not going to be better until some of these people, and one thing good about this affordable health care insurance, that there is money in there for treatment, right?
Right.
So they can get the treatment, and for families to prosper, they have to get that addiction under control.
Right. And I've said this many times. Most of everybody that we have in the jail that is there on a drug-related charge, that's still somebody's daughter, somebody's son, somebody's mother, father. They're related to somebody. And those families care about them peoples, and so should we.
That's right.
So it's getting them the help that they need so that they can get out of the correctional system.
That's right. Thank you.
Thanks.
Along those lines, I want to recognize EMA and EMS.
Hey,
EMS with their...
I'm sorry, can I interrupt you, sir?
Yeah, go ahead.
Just so you know, our next Delaware County Sheriff's Show will also, it'll emphasize on heroin and the meth problem that we have. And there'll be a lot of good educational stuff on there for citizens to see, so.
Thank you.
I just want to throw that in there.
EMS is the go out on all those calls, and EMA is there for traffic control purposes too. So I want to recognize those guys that are out every time there is a lab found or a bust. So thanks to everybody.
Takes a big group of people to put those on, but yes. Okay, thank you. Any good positive news today? I'll entertain a motion for
Make a
recess.
motion to recess.
Second.
Will you point out that the next meeting is going to be on a Tuesday, not a Monday?
Yes, Patty wanted me, Mrs. Lackey
Bill
reminds us
seconded.
the holiday is coming up, so it will be Tuesday, September the 8th, same time. Please make a note of that. Thank you very much. Motion. Roll call.
Mr. Henry.
Yes.
Mr. King.
Yes.
Ms. Reagan.
Yes. Thank you.